Hello, Professor Hömberg. Thank you very much for your presence in this important scientific event in a couple of days in Romania, the 12th European Teaching Course on Neurorehabilitation in Eforie, and now in Cluj-Napoca, the Symposium on Cerebrovascular Diseases, a Multidisciplinary Approach. How relevant and useful is this multidisciplinary approach in the field of cerebrovascular diseases?
Well, multidisciplinary approaches in general are very important. In all fields of medicine, you cannot do anything without multidisciplinary approaches. Let's say when it comes to cerebrovascular diseases or stroke, or other vascular problems. Of course, there is an interaction. You have the general practitioner, you have the acute neurologist, you have the neurosurgeon, you have the intensivist, and later on in rehabilitation, you have the rehabilitation neurologist, you have physiotherapists, occupational therapists, and so forth. And the entire, let's say, piece of art, what to do with a stroke patient, of course, is very much dependent on the interplay of all these partners involved. Therefore, multidisciplinary is absolutely a must. On the other side, some people claim multidisciplinarity, and it's not always true. But it's for these meetings here in Romania for years, we have always tried to keep it as multidisciplinary as possible, and that is not just pretending to do so, but that happened in actual fact.
Which is great. In your opinion, are there any particular aspects that scientists and practitioners should contemplate more in order to better embrace the continuous evolution of digitalization?
Well, that is a very, very important and very interesting question. I think over the last years, especially also driven by the pandemic, I think we have, if there was anything good or reasonable with the pandemic, it was that we learned to have a greater ease in using digital technology worldwide for many purposes. In the field I am working in, and that is neighboring to many other fields in medicine and neurology in particular, I see three major points in it. One is the use of digital technologies for communication. That is very important, for instance, when it comes to spreading information, spreading knowledge, spreading procedures around the world. We have hundreds of millions of people around the world who have no access whatsoever to any sort of rehabilitation, and there is no chance that they will have it in not too distant future. And in this gap, digital technologies, of course, can be extremely, extremely helpful. The second element, which is of importance in our fields, and in many other fields of medicine as well, is the use of digital technologies to improve the contents of what we're doing. For instance, using augmented or virtual reality for improving the way we are presenting, let's say, gaming material or stimulation material or task material to patients. And that is improving dramatically, as is, for instance, the field of brain-computer interfaces, how you can pick up information from the brain to make, just by thinking, make things happen or make things move, which is also a very interesting topic, of course. Years ago, it took a patient who wanted to just control, let's say, an exoskeleton, an external device, by his thoughts, took hours to train that, sometimes days. And today, when we use these brain-computer interfaces, just minutes, and the system works. You pick up with some electrodes the electrical signals from the brain, from the scalp surface, and it works. This is, of course, offering completely new perspectives using digital technologies. And a third element I would like to mention is really to use digital technologies, especially artificial intelligence, to improve the quality of data organization and also of knowledge organization, in the sense that, for instance, you can imagine the amount of information from experimental work and from clinical work and studies and so forth is giant, really. And nobody can read all of this, but an artificial intelligence system, of course, can take care of this. And if you have, let's say, a young doctor in a hospital who's faced with an interesting or complex patient, artificial intelligence certainly can help him. What the guy could do is go into the literature by whatever means. That is one possibility, but it's easier just to type in a set of symptoms and information and data and get, let's say, at least a selection of possible solutions. And in this sense, artificial intelligence can help physicians very much to make decisions. Furthermore, we have been involved in many sorts of studies in organizing knowledge, making or deriving guidelines from these studies, which is a very time-consuming work, as you can think, and many scientists and associates are involved in that. And I could imagine just to update this information for the future, artificial intelligence system can be helpful to do it on a, let's say, monthly or even weekly basis, just really to update the information to the newest available elements, which is virtually impossible to do just by human work.
Right. And one last question. As the world enters the third year of COVID-19 pandemic, physicians are facing complex neurorehabilitation cases. In your opinion, what improvements are needed in the diagnosis, treatment, and of course follow-up of post-COVID neurological patients?
Well, we certainly are faced with the situation there is something existing as long COVID problems. My impression is that this long COVID problem sometimes is a little bit overemphasized, even creating a lot of anxiety and fear in many patients who definitely do not have long COVID problems. So it really needs careful analysis. It's interesting to note there are many varieties of COVID problems and long COVID problems. The interesting finding is that people who have suffered a lot from acute Corona-19 infection with long stay on the ICUs with ECMO and other techniques involved hardly ever develop this. They may have longer lasting neuromuscular problems, as many people staying on ICUs for a long time have, as what we call critical illness neuromyopathies. But those patients who have only very mild corona problems, they have a higher tendency to develop, especially the fatigue problem with long COVID. And this long COVID fatigue, which is very similar to what we know for many years as chronic fatigue syndrome, for instance, is a particular problem. We believe more and more it may be an autoimmune disease. We had similar examples. In 1955, at the Royal Free Hospital in London, they had an outbreak of what probably was a viral infection, and about 100 or so of staff from the Royal Free were affected with a strange type of disorder with a lot of fatigue problems involved. The term chronic fatigue was coined later, but this was probably the first of these outbreaks. And there is good, at least we have to consider that long COVID problem related to fatigue may be an autoimmune, longer lasting autoimmune problem. Seen similar things with SARS and MERS and other viral infection, not at that numbers because the numbers were factor 1,000 lower. But nevertheless, I think we need to know and learn more about that. We certainly also have to learn more about possible, let's say, interventions for long COVID problems. At the horizon, there may be one or the other drug which may be helpful. Some people are playing with plasmapheresis or apheresis systems to get rid of possible antibodies in the blood to involve it. My impression is that many of the patients suffering from fatigue-dominated long COVID problems, they certainly need help. We have developed a special app for counseling patients with long COVID problems. This is available in 11 languages now worldwide, free of charge, and can be helpful for people to restructure their everyday lives, having sort of a fatigue diary, and also having some hints for relaxation techniques and for, let's say, a moderate, if any, moderate exercising. The greatest problem with these people is that they may eventually do too much exercising, because people believe exercise is good for rehabilitation, but that is eventually not good for fatigue-dominated long COVID patients. So we have to certainly have to learn more about that in future.
Great. Thank you so much for
My
sharing
pleasure.
your opinions and great experience.
Thank you very much
Looking
indeed.
forward to seeing you in our future
No,
events.
it's a great pleasure to be back to Romania after these years, and the last days certainly were a great pleasure for me. Thank you.
Thank you.